American doctors deliberately infected mental patients with syphilis in 1946, and the U.S. government knew. In a psychiatric hospital in Guatemala City, men who could not consent, who could not refuse, who often could not even understand what was happening to them, became subjects in experiments designed to test whether penicillin could prevent sexually transmitted diseases. What no one knew at the time, what wouldn't surface for more than 6 decades, would eventually force a sitting American president to apologize to a foreign nation. The experiments were not the work of rogue scientists. They were funded by the National Institutes of Health, coordinated by the U.S. Public Health Service, and conducted with the full knowledge of American medical authorities. Between 1946 and 1948, researchers infected nearly 1,300 Guatemalans, prisoners, soldiers, psychiatric patients, even sex workers, with syphilis, gonorrhea, and chancroid. The goal was scientific. The methods were criminal, and the cover-up would last until 2010. Dr. John Cutler arrived in Guatemala in 1946 with a mission. He was a young physician working for the U.S. Public Health Service, ambitious and eager to make his mark in venereal disease research. The war had just ended, and penicillin had emerged as a miracle drug. But questions remained about how to use it effectively, whether it could prevent infection, not just cure it. American law and American ethics made such research impossible on American soil. You could not deliberately give someone syphilis in the United States and expect to keep your medical license. But Guatemala was different. Guatemala was far away. Guatemala was poor. And Guatemala had a government willing to cooperate with its powerful northern neighbor. Cutler set up operations at the Hospital Nacional de Salud Mental, a psychiatric facility where patients had no advocates, no families visiting, no one to ask questions. He worked with local health officials who provided access to the National Penitentiary, where prisoners became test subjects. He arranged for infected sex workers to visit soldiers at military bases, transmitting diseases to men who had no idea they were part of an experiment. The infection protocols were methodical and grotesque. Researchers exposed subjects to disease through multiple means: sexual contact with infected prostitutes, direct inoculation through skin abrasions, and injection of bacterial material directly into the spine. Some patients had syphilis-infected material rubbed into their eyes, their faces, their genitals. The psychiatric patients were the most vulnerable. Many suffered from severe mental illness and could not understand what was being done to them. Some were inoculated repeatedly when initial infections failed to take hold. The researchers documented everything: the infections, the symptoms, the progression of disease, in meticulous detail. Not all subjects received treatment. The experiments required control groups, men who would be infected but not cured, whose deterioration could be measured against those who received penicillin. At least 83 people died during the experiments, though researchers never acknowledged that the infections they induced were responsible. Cutler kept records. He wrote letters to his colleagues in the United States, describing his work in clinical language that masked its horror. He sent progress reports to the NIH, which continued funding the research. He corresponded with Dr. John Mahoney, his mentor at the Venereal Disease Research Laboratory on Staten Island, keeping him informed of results. But Cutler also expressed anxiety. In one letter, he acknowledged that the work could never be published, that the methods would not survive scrutiny. He knew, even as he conducted the experiments, that what he was doing violated the principles his profession claimed to uphold. The research continued anyway. When the experiments ended in 1948, the records were boxed up and shipped back to the United States. They were filed away in archives, unclassified but unexamined, waiting for someone to find them. But that discovery would take more than 60 years. And what happened to John Cutler in the meantime would reveal the depth of the medical establishment's complicity. John Cutler did not face consequences for Guatemala. Instead, he was promoted. In 1932, the U.S. Public Health Service had begun the Tuskegee syphilis study, tracking the progression of untreated syphilis in black men in Alabama who were never told they had the disease and never given penicillin, even after it became the standard cure. By the 1960s, John Cutler was helping to run that study. The same physician who infected Guatemalans without consent went on to deny treatment to Americans without consent. The pattern was the same: vulnerable populations, deceptive practices, scientific racism, and institutional protection. Tuskegee continued until 1972, when a whistleblower finally exposed it to the press. Cutler defended his work until his death in 2003. He never apologized. He never admitted wrongdoing. He claimed the experiments reflected the ethical standards of their time. The records from Guatemala remain buried, and Cutler took his secrets to the grave, or so it seemed. Susan Reverby was not looking for Guatemala. She was a medical historian at Wellesley College, researching the Tuskegee study, trying to understand how such an obvious violation of human rights could have continued for 4 decades. In 2005, she was granted access to the papers of John Cutler, which had been donated to the University of Pittsburgh after his death. She found folders labeled Guatemala. Inside were photographs, correspondence, experimental protocols, and detailed records of deliberate human infection. Reverby realized she was looking at something that had never been publicly documented, a medical atrocity that predated Tuskegee and shared its architect. She spent years verifying her findings, consulting with colleagues, building an airtight case. In 2010, she presented her research at a medical history conference and published her findings. The reaction was immediate. On October 1, 2010, Secretary of State Hillary Clinton and Secretary of Health and Human Services Kathleen Sebelius issued a joint statement. They called the Guatemala experiments clearly unethical and deeply disturbing. President Barack Obama personally telephoned Guatemalan President Alvaro Colom to apologize. The Obama administration convened a bioethics commission to investigate. Their 2011 report confirmed Reverby's findings and documented the full scope of the atrocities: at least 1,308 subjects exposed to disease, including children in orphanages. The commission found no evidence that any subject had given informed consent. They found no evidence that the experiments had produced any medically useful results. Guatemala filed suit in U.S. courts, seeking compensation for the victims and their descendants. The cases were dismissed. American courts ruled that the U.S. government had sovereign immunity and that the statute of limitations had expired. The victims and their families received apologies, but no reparations. The Guatemala experiments force us to confront uncomfortable truths about medical research, about power, and about the lengths to which institutions will go to protect themselves. The same scientific establishment that gave us vaccines and antibiotics also gave us Tuskegee and Guatemala. The same government agencies that protect public health also funded deliberate infection of the vulnerable. John Cutler was not a monster who operated in the shadows. He was a respected physician who worked within institutions, who received funding and promotions, who was protected by colleagues who knew or should have known what he was doing. The experiments were not a secret in 1946. They were simply not discussed. The victims in Guatemala were chosen because they were disposable: the mentally ill, the imprisoned, the poor in a country too weak to challenge American power. Their suffering served science, or so the researchers told themselves. But the experiments produced no breakthroughs, no cures, no discoveries worth the cost. What remains is memory and the obligation that memory carries. The Guatemalan patients who were infected without their knowledge, who suffered without understanding why, who died without justice, they cannot be made whole. But they can be remembered. And in remembering them, we acknowledge that the history of medicine is not only a story of triumph over disease, it is also a story of power abused, of vulnerable people exploited, and of institutions that chose silence over accountability for more than 60 years.